The necessary equipment for this skill is a traction splint and padding material. The recommended PPE for this skill are gloves and eye protection. Once I've assembled the necessary equipment, I'm going to have my partner place and maintain manual stabilization and traction of the patient's injured extremity. I'm then going to assess sensory motor and circulatory functions in the injured extremity. Checking pedal pulse. Assessing capillary refill, less than 2 seconds. Asking the patient if they can move their toes. So can you move your toes? Okay. Go to adjust and position the splint. Secure the ischial strap. Apply the ankle hitch. And apply the appropriate amount of mechanical traction. Secure the support straps. Reevaluate the ischial strap and the ankle hitch, and reassess sensory motor and circulatory functions in the injured extremity. Checking pedal pulse, checking capillary refill, less than 2 seconds. Ask the patient if they can move their toes. So can you move your toes? Okay. I would then move the patient to a long spine board and secure the patient's hip to the